Despite the link between sexual contact and transmission, is monkeypox a sexually transmitted disease? Because of its rapid spread among sexual partners, many people wonder while experts say this rumor is not true. However, according to recent social media posts, if monkeypox is a sexually transmitted disease, why are children getting this disease? According to some people, monkeypox is spread through gay sex. I am Jahangir Bukhari, consultant herbalist from HerbConcept.s. Cases of monkeypox continue to rise in the United States and globally. This type of misinformation becomes alarming. To prevent the number of cases from increasing rapidly, it is important to understand how the virus spreads, with about 98% of the cases reported so far involving men who have sex. World Health Organization experts also advise gay and bisexual men to temporarily limit the number of sexual partners they have. Reduce the spread of monkeypox in these communities. Because of its rapid spread among sexual partners, many people are wondering if monkeypox is actually a new sexually transmitted infection STI. Giving this distinction to monkeypox, however, may be a step too far. According to one U.S. health expert, contact is involved. Thus sexual contact appears as a risk factor. Here's what we know about how monkeypox is spreading in communities of men who have sex with men, plus a look at the potentially harmful consequences of calling the virus an STI. Now, the question is this, that why monkeypox spreads between sexual partners. Although monkeypox is highly prevalent among men who have sex with men, this does not necessarily qualify the virus as STI. Health experts explain that strictly defined, sexually transmitted infections are spread primarily or exclusively through sexual contact, such as gonorrhea or chlamydia. While monkeypox is quite different, it is mostly spread by direct contact with active lesions, possibly also through respiratory secretions. In other words, sexual activity is not a predictor of contracting monkeypox as it is for other STIs. Coming into close contact with someone who has monkeypox can certainly happen during intercourse, but it doesn't have. According to the Centers for Disease Control and Prevention (CDC), in addition to direct contact with monkey bites, monkeypox can spread through contaminated surfaces or objects, from a pregnant person to her fetus, or through respiratory secretions. Researchers are still trying to determine whether, like other sexually transmitted diseases, monkeypox can be transmitted through sexual fluids. Is it because you have contact with skin or even rectal lesions that are not always present that you have transmission? Or is it because of bodily fluids such as semen? Given how the virus is spreading in this outbreak, sexual fluids may play a role, among other confirmed methods of monkeypox transmission. Is it because you have contact with skin or even rectal lesions that are not always present that you have transmission? Or is it because of bodily fluids such as semen? Given how the virus is spreading in this outbreak, sexual fluids may play a role, among other confirmed methods of monkeypox transmission. Another reason we're seeing an outbreak right now, one expert said, is probably because of one or more outbreaks where large numbers of gay or bisexual men became infected with the virus. The Associated Press reported in May that those incidents may be two that took place in the spring. A third factor is that when smallpox lesions are smaller or more inconspicuous, the virus spreads more stealthily. It's like a number of factors coming together at the same time: a large susceptible population, and increasing incidence, and then possibly spreading in ways that wouldn't be clearly noticeable. And if one have many pox on the body, others will not touch them or engage in intimate intercourse. But if you are transmitting before it is present, or if it is only present in your rectum, for example, where no one can see it, you can have a lot of transmission. All of these factors combined may partially explain current outbreaks in communities of men who have sex with men. But monkeypox is still not an STI. Although monkeypox appears to spread between sexual partners, close contact is usually the culprit. Sexual contact is a form of direct physical contact, said one expert. I worry that focusing too much on sexual contact alone may delay the identification of monkeypox in other settings, because it's really only direct contact and not specifically sexual contact that facilitates transmission. In addition to being medically inaccurate in terms of how we currently understand the virus, some medical professionals are concerned that calling monkeypox an STI is harmful to gay and bisexual men, and the general public. There is concern that the circulation of monkeypox in the gay and bisexual communities may lead to discrimination that stigmatizes men's same-sex relationships and sexual activity, despite the fact that any person may have sex with another person. Close contact with the person can spread the disease, and for people outside these communities, it can give them a false sense of detachment from the spread of monkeypox. Although monkeypox is not an STI, experts say reducing close skin-to-skin contact, especially by reducing the number of sexual partners a person has, is currently the best way to reduce the spread. Men who have sex with men, because they are at higher risk of contracting monkeypox during this outbreak, can contact their doctors to get vaccinated. However, this is easier said than done at the moment. In New York City, demand is so high that officials are delaying a second round of the shot so that more people can get at least some protection from monkeypox. But having the tools in place and knowing which communities to target will hopefully bring the monkeypox epidemic under control soon. If we can control this outbreak and get lots of vaccinations in high-risk communities, and then get rapid diagnostic tests so people can quickly test themselves, isolate, to get support for isolation, and then get people on antivirals early so they can avoid getting sick, he said. Don't spread the virus for too long. Then all those factors. Hope you like this informative video. If you want to see more videos on such topics, then subscribe this channel. Herb Concept.